Hi there, my name's Emily. Don't forget to hit subscribe and the notification bell so you don't miss out on any of our videos. Cardiac arrest can affect anyone at any time, and in fact 30,000 of them occur outside of hospitals across the UK each year. Unfortunately though, currently less than 10% of these people experiencing cardiac arrest in the community survive. But with speedy emergency treatment, chances of survival shoot up by a whopping 80%. CPR and AED shocks given within the first 4 minutes are crucial to enable survival. Yet terrifyingly, the average ambulance response time is longer than that 4 minutes, depending on where you are in the country and also in the world. 20% of out-of-hospital cardiac arrests happen in public places. And if you suffer an arrest out and about, you would be reliant on the public's ability to perform CPR and indeed the availability of a defibrillator. CPR alone can double the chance of survival, but when you use a defibrillator in addition to good quality CPR, the odds of someone's survival can jump from around 6% to a massive 74%. That's an incredible difference. So what is an AED? AED stands for Automated External Defibrillator. Defibrillators are the brightly coloured boxes that you might have seen in supermarkets, tube stations, railway stations, bus stations, airports, some telephone boxes in rural areas, and also high traffic areas and public places. Have a look where your nearest one is. Make sure you know where the nearest one is to your home. Does your workplace have one? If you're not quite sure where your nearest one is, there are a few apps that can help locate them. So there's apps such as Heart Start, Good Sam, AED Locator. There's lots of different ones out there. Do have a look where your nearest one actually is. Because as soon as you get one there, the better, as we said, the chances of that person surviving. Other places we can find them will be things like sports centres, leisure centres, outside pubs, outside churches, inside them. So an AED can automatically detect if someone is in a shockable rhythm, and it speaks to you, it tells you what to do. Defibrillators do not jump-start the heart like starting a car. What they actually do is they stop it. A bit like when you reboot a computer or a phone. Ultimately, this allows the individual cells to recharge simultaneously and the pacemaker in the heart to hopefully restart in its normal rhythm. So basically, you know when your computer doesn't work properly, you kind of reboot it. That's kind of what the defibrillator does to the heart. So when it turns back on again, when the heart starts again, it will be beating normally. So the defibrillator will detect certain rhythms, and sometimes it will administer a shock to stop the heart if it's in an abnormal but shockable rhythm, enabling the heart's own system to reboot and hopefully restart in a sinus rhythm, a normal heartbeat. AEDs are used in addition to CPR to save the lives of those suffering from a cardiac arrest. It is not CPR or an AED, they are used together. And research has shown that deploying a defibrillator within 3 to 5 minutes of a collapse can produce survival rates as high as 70%. So in other words, as soon as you see someone going to cardiac arrest, then make sure you start CPR and you get someone to get you that defibrillator. Anybody can use a defibrillator. You do not need to be trained to do so. They talk to you.
Shock advised.
Now, using an AED is crucial to be able to have a chance of bringing someone back following a cardiac arrest. CPR is great because CPR will help circulate the blood. It will keep the heart and brain sufficiently oxygenated, but the AED is necessary to deliver the shock, which will hopefully return the heart to a normal, viable rhythm. Most sudden cardiac arrests results from ventricular fibrillation, VF. VF is a fast, erratic heart rhythm. It's a bit like you've got a jelly on a plate, so rather than the ventricles beating like this, they're going into a quiver, a bit like a jelly would. Now an AED will only be able to give a shock if it recognises one of these shockable rhythms, VF meaning or even VT. The machine will recognise these rhythms and advise whether to shock or not shock. So sometimes you might find the machine saying no shock advised. please don't worry, just carry on with your CPR. Now let's talk about how to use an AED, because hundreds of people are alive today entirely due to the prompt and appropriate use of a defibrillator. For every minute's delay in deploying a defibrillator, the odds of survival reduced by about 10%. So firstly, activate the machine, turn it on. Machines vary, but this is usually done by opening the lid or pressing an obvious on and off button, but you want to turn it on. You will need to remove the patient's clothing. So you need to be able to cut the t-shirt, the jumper off using a pair of scissors, which is normally inside an AED. It's normally like a little accessory kit to remove the clothing. Sometimes you might need to shave the chest as well. So you might need to dry the chest, use a razor to shave it, because the pads need to stick to naked skin. Peel the pads off one at a time and place them onto a dry chest according to the diagram on the packet or on the video of the AED. Normally one pad is placed below the casualty's right collarbone and position the other on the casualty's left hand side over their lower ribs. The AED will then begin to analyse the heart rhythm. Stop CPR when instructed to do so by the AED. It will say do not touch the patient. Ensure no one is touching that casualty. If a shock is advised, then check the whole length of the casualty to make sure no one is touching that casualty before you push the button. Sometimes the AED will automatically shock, but make sure you shout, "Clear, stand clear," a bit like you see on the films. So you might need to press that flashing shock button, or as I said, it might do it automatically for you, but make sure no one is touching until that shock has been given. When the shock's been given, you continue with CPR as directed by the machine, and you keep going with 30 compressions to 2 rescue breaths. You do not stop to check them unless they begin to regain consciousness or they show signs of life such as vomiting. The machine will reassess the heart rhythm normally every 2 minutes, and they'll advise another shock if indicated, or they might say no shock advised. Please, if it says no shock advised, just continue with CPR and follow the prompts. Keep going until help arrives, and only stop CPR if the casualty begins to regain consciousness or until you become too tired, you can't carry on and there's no one else there to take over from you. If there is someone else that can take over from you, make sure you keep swapping. Now don't forget to look at our video about giving CPR during this current pandemic, because rescue breaths are not currently advised. But it depends on the possibility of COVID-19, also your close contact with them as well. So I'll leave the link below so you can check out that video, and also the advice of the Resuscitation Council in the UK.